Hi, my name is Fadi Shamoun. I'm a cardiologist at the Mayo Clinic in Arizona. With me here is Dr. Christine Parson, who's an internal medicine resident, and I'd like to welcome you to this podcast where we discuss our article that will be at the Mayo Clinic Proceeding. And the article title is the CHA2DS2-VASc score, a predictor of thromboembolic events and mortality in patients with implantable monitoring device without atrial fibrillation. We work with a team of researchers from the Mayo Clinic, both in Arizona and Rochester, to extract these data. And we currently understand that there is a relationship between atrial fibrillation and stroke. However, there is also an increased evidence in the literature to suggest that stroke is related to atrial fibrosis, atrial inflammation, and elevated atrial filling pressure, and sometimes without the presence of atrial fibrillation. Our work here support these findings. Christine, can you provide us with an overview of your clinical findings?
We conducted a retrospective chart review using the Rochester Epidemiology Project. This is a system that links medical records in Minnesota, including those of Mayo Clinic Rochester. We evaluated whether the CHA2DS2-VASc score predicted thromboembolism and mortality in this population. We required that patients had an implantable monitoring device, such as a pacemaker, ICD, or loop recorder, to better ensure the absence of atrial fibrillation. We found that the CHA2DS2-VASc score predicted incident thromboembolism and mortality.
What is the takeaway message of your article?
So we found that the CHA2DS2-VASc score predicted thromboembolic events and mortality in patients without atrial fibrillation. Looking specifically at some of the numbers, a CHA2DS2-VASc score of 6 to 9 had a hazard ratio of 8.18 for mortality with a p-value less than 0.001. And similarly for thromboembolism, a CHA2DS2-VASc score of 6 to 9 had a hazard ratio of 10.53, again with a p-value less than 0.001.
How does these findings change the way we take care of our patients?
So the CHA2DS2-VASc score is well validated in patients with atrial fibrillation. It's used to risk stratify those patients for their development of systemic emboli and put them on anticoagulation with high enough risk. So potentially this would be used to risk stratify patients in the clinic, and eventually after further research might be indicative for putting people on a blood thinner.
What do these findings mean for our patients?
Yeah, so we looked at a high-risk population. So in patients with similar risk, we could tell them their risk of a stroke or mortality based off of the factors included in the CHA2DS2-VASc score, whether they had atrial fibrillation or not.
So what do you think the next step in research will be?
Yeah, so we're looking at adding renal function to the CHA2DS2-VASc score as well in this population to see if that adds incremental predictive value for thromboembolism and mortality. We're also looking at if the patients are anticoagulated, whether that would decrease the risk, and if there would be significant bleeding events.
Thank you, Christine, and we appreciate that you reviewed this article with us, and we look forward to read it in Mayo Clinic Proceedings.
Yes, I will as well.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.